The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to tonight's webinar. We're going to wait just a couple minutes here and make sure everyone can jump on. Just give us a couple minutes and we'll go ahead and get started. Hello, everyone, and welcome to day 2 of the APHA-ASP webinar series. Tonight's webinar is for Patient Care Vice Presidents. We're going to go through a little about what you need to know as a Patient Care Vice President or any chair or executive committee member when it comes to patient care projects. My name is Maggie Oser, and I am one of your 2 APHA-ASP national members at large. You'll see my email right there. If you'd like to jot that down, feel free to ask me any questions. I love emails and love answering questions, so you can always reach out to me. Just a couple of housekeeping before we get into everything, our webinar procedures. Right now, everyone is in listen-only mode. If you would like to listen via the telephone, you can do so. There should be a number listed on the screen and then an access code. If you want to listen to the webinar through your computer speakers, please click use mic and speakers. And if you are on a telephone, we ask that you mute yourself until you ask a question, if you so choose, just to keep any background noise out of the way. During the webinar, in order to ask a question, you can either use the raised hand function. Now, this will give somebody the opportunity to unmute your line and you can ask your question. That's probably more towards the Q&A at the end. However, if you do have questions that come up during the webinar, please feel free to type them into the question box. That way we can kind of get a queue going. We can start answering them at the end of the webinar, and that way you won't forget your question. So please feel free to type them as we go. So to get started here, we have a poll. We'd like to see who is on the call tonight. So tonight's first poll question is, what is your role within your APHA-ASP chapter? Crystal, do you want to start that for us?
All right, so everybody should have the poll question now open on the screen. So what position are you currently holding? Are you the chapter president and president-elect, or patient care vice president, a member of a patient care committee, a general member, or do you hold another position? So give everybody just a couple of seconds to get those answers in, and then we will share the results. All right, it looks like almost everyone has responded, so I'm going to go ahead and close the poll now. And it looks like the majority of you, at 50%, are currently serving as a patient care vice president. And then we've got a pretty even split between chapter presidents and committee members as well. So Maggie, back over to you.
Awesome. Well, I'm glad we have kind of a diversity of people on the line. Hopefully this webinar will be useful to all of you. So our agenda for this evening, we are going to go through the APHA-ASP patient care projects and programs. We're going to go through the patient care vice president roles and responsibilities, the resources available to you for your patient care projects, and then information on reporting and awards. So we're going to get started with the APHA-ASP projects and programs. So before we do get started, I would like to start another poll. So our second poll is to see which of the following patient care projects that your chapter participates in. So Crystal, would you start that poll for us, please?
All right, the poll is now open, and this one's a little different. You can choose more than one. So if you participate in multiple projects, you can click those. So click any of those that are appropriate. We've only listed our national initiatives tonight, so if you have local initiatives, make sure that you click the other box for some of those local projects that maybe aren't official APHA-ASP projects. I'll give everyone just a couple more seconds to respond. And it looks like almost everyone has. I'm going to go ahead and close the poll, and we'll share those results. So almost universal, Operation Diabetes, Heart, and Immunization all has 88% of you participating in them. And then Generation RX, 90% of you participate. And then we have 50% of the attendees who have another project. So great, we're glad to see that you're very active in the patient care activity. Back over to you, Maggie.
That's awesome. That's very exciting. I'm happy to hear that. And I'm really glad to see that a lot of chapters do have their own individual chapter-specific projects, because that innovation is really important and it really helps keep your members involved. So as a patient care vice president or any officer or chair, it's important to know why we have and participate in these patient care projects. This year, our APHA-ASP National President, Nick Capote, has issued a challenge to discover your voice. Patient care projects are a really great way to encourage your members to discover their voice. The patient care projects can help you find your passion. Maybe you have a knack for helping patients understand their blood sugars and manage their insulin. You can discover this knack through participating in Operation Diabetes and working with this patient population. Through these patient care projects, you can find the patient population you love to work with, and so can your members. You can develop your skill set. Practice makes perfect, we all know this. Taking the skills that you learn in lab and using them out in the field benefits not only you, but also your community, which is really important. You can apply your knowledge. Application is one of the best ways to learn. You can take what you've learned in the classroom and use it with your patients, and this really can help to solidify your education and really apply that knowledge you've learned and better understand it. You can really enhance your education through the patient care projects. By developing your skills and applying your knowledge, you're going to be a great student pharmacist and a great practitioner, and that's why we're in school. Not to mention, participating in these projects can help you find your passion that will help guide your career. And finally, and possibly most importantly, you can make a difference for your communities and really touch those people in your community. You can show the public what student pharmacists and pharmacists can do. Through participating in patient care projects, you are advocating for your profession, even if you don't know it. So now that we know how the patient care projects can help you to discover your voice, let's go through and review our national initiatives. So Operation Diabetes is sponsored by Rite Aid, and this helps student pharmacists to identify individuals in the community with previously undiagnosed diabetes and those who are at risk of developing the disease. Through Operation Diabetes, you can participate in glucose screenings and work with a variety of healthcare providers on prevention and management, help patients discover healthy lifestyle choices, and help patients to understand and prevent the risks and complications that accompany diabetes. So something to note, coming up very soon, Diabetes Awareness Month is in the month of November. So this is a really great opportunity for you to capitalize on your Operation Diabetes events and really educate the public on how pharmacists can help manage diabetes. And it comes right after American Pharmacist Month, so it's great timing. Next, we have Operation Heart, which is sponsored by Walgreens. This helps student pharmacists to raise public awareness of cardiovascular disease and its associated risk factors. You can help provide patients with prevention strategies for reducing their risks and managing their therapies. And you can help promote the profession of pharmacy and the role that pharmacists have in the prevention and management of cardiovascular disease through blood pressure screening, cholesterol screening, tobacco cessation, and diet and lifestyle modification. So there really are a lot of different opportunities for you to participate in Operation Heart, a lot of different events that you can come up with at your chapter. Next, we have Operation Immunization. This is sponsored by Safeway, and it aims to increase the public's knowledge of immunizations, as well as help raise the number of adults receiving immunizations. So student pharmacists can participate both by education and by immunizations when possible. So now not everybody can provide immunizations, but you can partner with other healthcare providers, whether that be pharmacists or nurses or doctors, and help build those partnerships and use that opportunity to educate the public what you can do as pharmacists. Next, we have Generation RX, and this is a very popular patient care project or outreach program. This is sponsored by Cardinal Health Foundation, and it really shoots to enhance the medication safety and combat the increasing misuse and abuse of prescription drug abuse. So this is through a lot of educational prevention. Medication misuse and abuse is a growing epidemic in our country. This is a really great program because it's applicable to literally all age groups and all patient populations. And it doesn't require any screening. So even if you're a first-year student pharmacist, you can still get involved in Generation RX. And even pre-pharmacy students, this is a really, really great opportunity to get any pre-pharmacy students you might have in your chapter involved. So now that you know all about the different patient care projects, let's talk about your responsibilities. So the patient care vice president roles and responsibilities. The first one is familiarity. Now this is going to be with all of the projects which we just went through, so you want to have a good idea of what all these projects and programs are. You also want to be familiar with the resources available to you and the relationships that are within your chapter. Organization is another big one. This is organization of your chairs and also the events that you have. Recruitment. Obviously, you can't have these events if you don't recruit your members, so you really need to focus on recruiting members to participate. Relationships. Can't stress how important this is. These are relationships with other student organizations, with your chapter members, with your faculty and staff, with local pharmacists, with community partners. Developing these relationships are really the core to your patient care project events. And finally, reporting. Now, everybody who's been to annual knows how much fun the award ceremony is, and reporting is a very big part of this. So let's go in a little bit deeper to familiarity. Again, this is going to be your general APA-ASP knowledge. This includes the patient care projects and programs which we just went through. But in addition, you want to be familiar with the communication style guide and the correct terminology that we would prefer that you use when working out in the community. For example, we don't really like P1. We prefer first-year student pharmacist. And you shouldn't say pharmacy student. You should say student pharmacist. And it should always be APHA-ASP, no lone ASPs. There is a communication style guide that is on our website underneath chapter officer resources. It's not really that long, and it will give you a really good idea of the kind of terminology that you should be using with your members. Additionally, if you want to use our logos, it is important that you do not alter the logos at all. There are logos that you can use on our website, and then there's some guidelines on how to use those. So those are just some basic things that you as a chapter leader should be familiar with. Additionally, you want to be familiar with all of the resources that are available to you, and there are a lot. So we're going to go through here in a couple minutes a little bit more about the website and the planning guides, as well as the MRMs and annual meetings. So there's a lot, especially on the website and at all of our meetings, that are really great resources for you. Additionally, we're really excited for this new initiative, the Chapter Cookbook. Some of you may have heard of this already, but this is going to be a compilation of recipes of successful and innovative events from different chapters across the country. The first draft will hopefully be posted to the website soon, so stay tuned for that, and as well as an opportunity to add your own recipes and really help us grow this cookbook. Additionally, your advisors are very important resources. These are, again, great for relationships, not only relationships for your chapter, but in reaching out to the community, to your faculty and staff, to other local pharmacists, to alumni. Your advisors are a really key point in all of this. Additionally, they can help precept events and provide a lot of great ideas and guidance. So advisors are very important for your patient care project events. And finally, your regional officers, your education standing committee, and your national executive committee is all here for you. We would love to help you troubleshoot and brainstorm and connect you with other chapters at your region level or at the national level. So we are always, always here for you. So I want to show you guys a few screenshots of the website just so that you are familiar with where the things are. So this is at the APHA-ASP homepage on pharmacist.com. So pharmacist.com/APHA-ASP. You can also get to it from pharmacist.com. So if you scroll down, you'll see right here patient care projects and programs here in the middle. So this is where you want to go to get to all of these resources for the projects and programs. So once you click on that, this will pop up, and it has a list of the different patient care projects and programs, and they are all hyperlinks to their own individual pages. Now, each individual page has its own planning guide, so click on whichever one you want to get to. Once you're on the page, there will be some information up at the top, just like a summary and talking about some statistics and the award winners. But if you scroll down a little bit, you'll see the planning guide. Now, the planning guide will have an overview for both. It'll have an introduction and then something for your advisors and for student pharmacists. And then there will be a bunch of resources in there for you as well. Now, Haley is going to talk about this in a couple of minutes here, but I just wanted to show you where it is. Each site also has online resources, places that you can go. So this is Operation Diabetes right here. So they have the American Diabetes Association and then an APhA-ASP Operation Diabetes video. These are really useful online resources for you. And finally, I'd like to point out that the reporting guidelines are on each of the individual patient care project websites. These are not with the Chapter Achievement Awards reporting guidelines. Some chapter members get confused, or officers rather, get confused about where these reporting guidelines are. They are on their respective pages. So it's important that you take a look at those. They are due at the same time as the chapter achievement reports, but the guidelines are just in a different location. And then our sponsors are also listed on each individual page. So at this time, I would like to turn it over to Haley Trivet, our Education Standing Committee Vice Chair. She's going to go into more information about the planning guides, what is in them, and then what kind of programming you can expect at the MRMs and annual meetings. So Haley?
Hi, Maggie, and hello, everyone. Thank you all for having me tonight. So Maggie has done a really great job at showing you where you can find all of these resources. But right now, let's talk a little bit about what you can actually find in these resources to help you have a really successful year. So as she pointed out, in each patient care project webpage where they have the planning guide, you can find the introduction is the first link you're going to come to, and there is actually a really great resource in order to read about some excerpts kind of detailing what successful chapters have done to help win regional and national awards, and help you with some innovative ideas and see what's working for chapters across the country. There's also some help for your advisors, and also some tools to help maybe some uncertain chapter members feel really prepared to go out and participate in your patient care outreach programs. So maybe you have some students who haven't made it as far through the curriculum, but they really want to get involved. They have some charts in there to help them feel more prepared with, maybe for Operation Diabetes, what are the target blood glucose values? What are the common drugs that they might see at a brown bag event? So without taking them all the way through a therapeutics course, you can really help them feel prepared to get out there from day one. Now, also, there are some forms to help you document what you're doing, because I can speak as a former chapter president. You really want to start documenting as early as you can so that when you go to write your report, you can give us as great a picture as you possibly can about what all you did this year. So these forms are very helpful in giving you an idea of what to record in the meantime to help you have a really great report at the end of the year. Now, next you'll see an event planning form, which again has the documentation form attached, but it also has some tips to help you see what goes into planning a successful event. What do you need to be thinking about 2 months ahead of time, 1 month ahead of time, if you're unfamiliar with a specific event that your chapter really wants to get going. So I encourage you to go to that event planning link to help get off on the right foot. Now, next you'll see a promotion link under resources and a media guide. And this has been very helpful personally, and I've also heard some really great testimonies from some other chapters in that they weren't quite sure how to get the word out to their community, to their campuses. And so there are some really helpful things on here to help you maybe reach out to your local news station or your local radio station. And there are some tips for completing a successful interview
to get the word out about what your chapter is doing and how the community members can get involved. There are sample letters to the editor and public service announcements, and just some general tips that are really helpful in getting your word out there. Now, next, under the support tools, you'll find a plethora of items that can be really great to detail, like I said, those lab values and medication charts that may be helpful for your students, and even maybe a good brush up for you if you're further in the curriculum. So finally, on this planning guide, you'll find links to outside resources that we have found helpful in information and helping to create brochures. So really want to check those out. Those are good, solid resources for you and for your chapter. Now, I will say that this planning guide is updated every year by your National Standing Committee on Education, and we go through it each year to update the content, make sure it's relevant for you and helpful for chapters, and sort of weed out the old and bring in the new. So don't be afraid that it might be outdated. Know that we do look at that every year and try to make it as helpful as we possibly can. In line with the promotion and media guide that we see on this planning guide page, I also do want to direct you back to the communication style guide that Maggie mentioned earlier for the logos to include on your handouts, your flyers, and any kind of ads that you may do. And that can be found in that communication style guide under chapter officer resources. So I encourage you to go check that out. Now, if you ever have any questions about getting an event started or about a specific patient care project, like Maggie said, please feel free to call on us. We are more than happy to help you troubleshoot, give you some examples, and help you work through that. But not only are we there for you, but we also have opportunities for you to attend programming at our regional and national meetings. So first of all, coming up in October and November, we have our mid-year regional meetings, which I know everyone is very excited about. And first of all, on Friday, we encourage you to attend the chapter leadership workshop, where as patient care vice presidents that we have here with us tonight, you'll have the opportunity to network with other patient care vice presidents from other chapters and other officers, so that you have a great opportunity to network with them, share ideas, share concerns and troubles that you've been having, and hopefully build some really great relationships that you can take home and build on in the future to create some great regional patient care events and initiatives. Second of all, at MRM, we have a Generation RX workshop every Sunday. It's on Sunday morning typically, and that's another opportunity to hear from some successes that chapters have had in your region and to learn more about the Generation RX initiative. So that's another great opportunity for you to attend and to learn more about the Generation RX project. At the annual meeting, it's in San Diego this year in March, we actually have specific patient care project workshops where you, as well as your committee chairs and general chapter members, can attend and spend an hour learning specifically about each patient care project. So I really encourage you to make sure you have a representative at those meetings. I have learned so much from them in the past, and we try to get out some innovative ideas that you can bring back to your chapters to integrate into the next year. So that's another really great opportunity. And finally, I want to also remind you to keep a lookout in your Student Pharmacist magazine and your regional newsletters. There are many times that we feature chapters and their efforts in these publications, and it's just another really great opportunity to see what other chapters are doing. And if you're having trouble with a certain thing, you see another chapter is being successful, reach out to them and see what they've done to have that success. So with that, I will actually wrap up and encourage you again to contact either myself or the other Education Standing Committee members. You can find our contact information on pharmacist.com. But we wish you guys the best of luck this year. And Maggie, I'll turn it back over to you.
Thank you, Haley. Those were some really great rundowns on all of the awesome opportunities and resources that are available to everybody. So again, this is a lot of different resources that we have available to you.
So when you're coming up with your new patient care project events, or if you are ever struggling, there's a lot of different places that you can reach out to. So just please be familiar with those because they can be really helpful to you as a patient care vice president or as a chapter leader. So going on with the different roles and responsibilities of the patient care vice president, first of all, when it comes to organization, you want to make sure that you are having a good selection of your projects. So like we told you earlier and asked you which projects you do participate in, it sounds like we have a lot of people that participate in a lot of programs, which is awesome. It kind of shocked me, and I'm really happy to hear that. But we understand that not everybody has the resources possible to do all of the projects all of the time. So we want to make sure that you focus on quality over quantity. Get one project up and running smoothly before you start another. And when you do this, you want to consider the interests of your chapter members and the needs of your community. Now, again, since so many of you participate in so many of the projects, these are also things to think about if your chapter is looking to expand and maybe start a new project. Next, structure. Your committee structure is very important. So organized delegation will help you to accomplish more at your chapter. I promise. It really will. So I would highly suggest you considering having different committees. So either a chair, maybe even co-chairs sometimes, just general members on committees that are interested in positions, and then maybe even first-year chairs to get these first-year student pharmacists involved and interested early, and so that they can really get a good idea of what's going on. Logistics are important as well. You want to make sure you or your chairs know and have what you need to set up your events. Always remember to advertise your events. Utilize Facebook, email, listserv, word of mouth, anything you can. Get the word out there. Advertise your events. If you advertise, you'll get more people there. They will be more successful. Additionally, there are some legal considerations when it comes to screenings and immunizations. These vary by state, so you want to make sure you talk to your advisors, your faculty, your board of pharmacy. Just make sure that you're in compliance with everything that you're doing. Next responsibility is recruitment. So first, you want to find ways to excite everyone to get involved. You want to make sure your events are meaningful and fun, and they really draw in your student members. When it comes to your chairs, you want to consider, think of the way that you would tackle a project if you're giving very detailed instructions versus one where someone gives you a little bit more leeway for creativity. When you're given ownership of a project, you tend to give it your all. You want to motivate your chairs to take their events to the next level by giving them this ability to kind of run with it and do their own thing. You don't want to micromanage them. You want to make sure that you can keep everybody on task, but when you give people that room for ownership and innovation, they can really thrive. You need to understand your members. Some will be more comfortable in larger groups at group events. Some will be more comfortable with one-on-one patient interaction. Some people won't really want to show up to things unless there's another pharmacist present. You want to make sure you have a variety of events so you can kind of hit all of these different comfort levels with your members and get a variety of your members involved. You also want to think of levels of knowledge. Obviously, your first-year student pharmacists and your final-year student pharmacists are going to have a different knowledge base. You want to make sure that you can appeal to all of your members. When it comes to your first-year student pharmacists, make sure that they can do some patient education at your events, or maybe focus on Generation RX events for them. And you want to make sure that there's some opportunities for more skill application when it comes to your upperclassmen. You also want to have opportunities for people to take their involvement to the next level. Some people might be interested in leadership positions, but don't necessarily want to be on the executive committee. They might thrive as a chair. Again, think about getting your first years involved early. They will help with the continuity of your events. So you just really want to consider the different levels of leadership. And finally, you want to appeal to your members' interests. If someone has an idea for a new project, see if you can make it happen. Just with the ownership, when people have a personal connection or a passion for something, they're going to be more interested in what they're doing, and they're really going to take ownership of it. Next is relationships. Again, I can't stress how important your relationships are. Successful events require successful relationships. So you want to make sure you find community partners to work with. whether this be nonprofit organizations or local schools where you can go do presentations, local law enforcement for Drug Take-Back Day and Generation RX events, and clinics around the community. Pharmacists are important. Make sure you reach out to your faculty and staff. I feel like these are a very underutilized resource that are right at your fingertips. Approach your professor who teaches your OTC class. See if they want to get interested or want to get involved in anything. Maybe the professor that teaches the diabetes section of your pharmacy and therapeutics course. Maybe they want to help out with some of your Operation Diabetes events. Advisors, of course, like I mentioned before, these are very key people to keep involved, and again, they will help you build these relationships with other people in the community. Alumni are another group of people that students often miss, especially these alumni who just recently graduated and maybe they were members of APHA-ASP. They might still want to get involved. They might not be able to be a new practitioner mentor per se, but maybe they want to come and help precept some of your events. And then just your local pharmacists, maybe some of your employers, some of the favorite pharmacists you work with. These are people you can all reach out with to help to your events. And maybe they can set up new relationships for you at new sites where they work. And finally, other healthcare providers. Think of other student organizations, maybe in med school or nursing school or PT. We've seen a lot of different collaboration, which is really awesome to see. And it's important to note that we're really trying to collaborate as a profession. Pharmacy, they say, a lot of times we're kind of segmented and we're trying to come together as one and really, done after provider status and really come together as a profession. Start that early. Work with the other student organizations on your campus. Figure out ways that it can benefit both of your student organizations. There's really no reason for competition. You can make it work well for both of you. Next is awards. So our patient care projects, these would be our operations, Operation Diabetes, Operation Heart, and Operation Immunization. Their reporting cycle is the same as the Chapter Achievement Awards. So this is July 1st to June 30th, and the report deadline is July 15th. So there are 8 regional winners that are recognized at their MRMs, and then 1 national winner that's recognized at the APHA annual meeting and exposition. So make sure that you get your patient care awards in. I know some people get confused and they think that it's a part of the Chapter Achievement Awards process, but it is not. They are due at the same time, but they are reviewed by different committees, and there are different awards given. So please make sure that you are doing these reports if you're participating in these projects. Generation RX is a little bit different. Their reporting cycle is the first of the year to the end of the year, and the report deadline is in January. This is something I would highly encourage you to put on your calendar now and put in your calendar early so that you don't forget. It can be easy to forget it after the holidays. With the Generation RX Awards, 8 regional winners are recognized at the annual meeting and exposition, and the top 3 chapters get to send 2 representatives to the University of Utah School on Alcoholism and Other Drug Dependencies. So when it comes to the awards criteria, there are several things that we are looking for specifically. The first is collaboration. Again, this is with the other organizations on campus, other organizations in your community, and other healthcare professionals. We really want to see how well you collaborate. We really want to get more people collaborating in pharmacy and in the healthcare professions in general. The next is participation. How many of your student pharmacists are participating in your events? Is it several people that are doing everything, or are you really working to engage all of your members? How many faculty and staff do you have participating, your new practitioners, and other pharmacists in the community? Again, this comes down to relationships. Something really near and dear to my heart is originality, creativity, and innovation with your projects. We really like to see what you do, how you take these patient care projects and put your own spin on them, or how you can come up with your own patient care projects and really impact your community. We like to see these innovative things that you do because they're a lot of fun and they can really impact the community. And finally, again, impact your community. What is the outcome? How many people are you reaching, and what really is this effect that you're having on them? How are you showing them what student pharmacists can do and how pharmacists can help them? So with the awards comes reporting. You need to have a system. This can be very daunting at the end of the year when you need to put together a chronological list of all of the events that Operation Diabetes held all year long if you do multiple events per month. So you want to make sure that you are reporting year-round and you have a good system in place. Some people use Google Drive. Some people use paper slips that they have to turn into certain people. Whatever it may be, find what works for you and hold your chairs accountable for doing their reporting. This will also help you track your goals throughout the year. If you set goals to hold a certain number of events or reach out to new community partners, this will really help you keep track of things throughout the year. And again, I promise you it will make your life easier at the end of the year when it comes to reporting for awards. And now I would like to turn it over to Mallory McGee, who is the chapter president at the University of Kentucky College of Pharmacy. And the University of Kentucky actually won the Chapter Patient Care Award last year. So she is going to provide you all with some tips and tricks on how to be successful at your chapters. So Mallory, you can take it away.
Okay, can everyone hear me? I'm
You're
going
good.
to assume that's yes. Okay. So like she said, my name is Mallory, and I'm currently the chapter president at the University of Kentucky College of Pharmacy. And one of the things that we really strive to get across to our patient project chairs is to dream big. We want them to always try to have new events, hold events outside of our Lexington community. So with that, we require all of our patient care projects to have at least one event and one collaboration outside of Lexington. So this really helps us expand our reach into Eastern Kentucky, Western Kentucky, because we are a large state and we only have 2 colleges of pharmacy. So we really feel that our students can reach a larger set of the population if we expand outside of Lexington, where there are a lot of hospitals already. So some of the big things that Maggie wanted me to mention are how we do the collaboration. So we collaborate a lot within our own College of Pharmacy. We have NCPA and ASHP, and so we really encourage all of our patient care projects to utilize those resources, and especially with NCPA, go to community pharmacies and really use those contacts to reach the population in Lexington and outside of Lexington. And I know she did mention that some of you all, there is competition between, you know, NCPA, ASHP, APHA-ASP. But we really encourage our students to say, we're all in this for one purpose. You know, we can help you, you can help us, you can use our resources, stuff like that, to really encourage that collaboration. We do partner with, like Maggie said earlier, local law enforcement, with Generation RX. We do a lot of local and regional school visits, so maintaining those contacts is really important to, number one, continuing events and starting new events each year. So one thing we've really found to be helpful for our patient projects is to encourage leadership within the first-year student pharmacists. We found that when you encourage the first-year student pharmacists, it really helps them stay involved throughout the next 2 years that they're in school. And we do this by appointing co-chairs and committee subcommittees within the patient care projects, whether it's helping to organize one aspect of the event, or if it's an event where we're doing blood pressure screenings or blood glucose screenings. Then we really try to get the first-year students involved by doing mini teaching lessons. So we teach them how to do the blood pressure screenings, how to do the diabetes blood glucose screening, so that they can be actively involved. And then they can take that knowledge with them to their fellow first-year student pharmacists and throughout the rest of their time at the college. We've also expanded some of our projects outside of the APA-ASP sponsored projects, so we collaborate a lot with outside organizations such as nonprofits like Say Pharmacy in our community to help reach the subset of the population that's not normally, that we can't reach with just the APHA-sponsored projects. So basically, dream big. If an event doesn't work the first time, you know, we're always learning, figuring out what works, who we need to contact for the next year, how we can maintain those contacts. And then, you know, maybe the next year it can be a little bit bigger, and it might take a few years to get off the ground, but you never know if you don't try. So those are basically the big points for what we try to do every year. So yeah, if you all have any questions, feel free to ask at the end.
Thank you so much, Mallory. And like you'll see, her email is right there if you do have any questions for her. I think those were some good tips and tricks, and I really liked what she said at the end there. You know, don't get discouraged if things don't work out. A quote that I've heard, or a little saying I hear pretty frequently, is fail better. So don't be upset when things don't work out. Just figure out how to make them better and grow and improve. So hopefully those were some helpful tips and tricks for you. And again, if you have any more questions, you can email Mallory. Just as a recap, we went through all the patient care projects and programs. So we have them listed here again: Operation Diabetes, Operation Immunization, Operation Heart, and Generation RX. We went through the roles and responsibilities of the patient care vice president, which is to, first and foremost, motivate, excite, and inspire, and cultivate relationships, recruit members, and keep everything organized, as well as be familiar with the resources that we went through, and then what it means to report and some ideas for reporting. So with that, we would like to take any questions that we might have had during the call.
All right, thank you, Maggie, Haley, and Mallory for the information. So we've had several questions already lined up. If you have any questions that you thought of, please get those typed in and sent in. You can also use the raise your hand function if you're in an area where you can use your phone and would like to do so, so please feel free to use that as well. A couple of housekeeping items before we get into questions. So, and it's related to the questions, a couple of you have asked if you're going to be able to access this presentation after this evening, and the answer is yes. So if there are some people that you know wanted to be on, or if you want to refer to this later on, you will be able to do so. So stay tuned for information there. We'll be posting the link to that on pharmacist.com on the webinars page. So our next question, our next couple of questions actually have to do with reporting. So Maggie, I'm going to let you take a stab at this one. So if within the reporting guidelines, as some of you may be familiar with, at the end of the reports there are certain criteria that we ask for and things that we want to know internally at APHA. And we use that information for a number of reasons, but if there are things that aren't on there, certain screenings that we don't ask to be reported out, Maggie, is it still okay for chapters to do those types of screenings, even if we don't request the information?
Absolutely, and this kind of comes down to the innovation and creativity. You know, we like to see what all you can do. It's certainly not limited to what we're requesting. I think when it comes down to the chronological list, we probably ask that you don't report it there, just because that is a very specific format that we look through. But we would love to hear about what you're doing within your reports. So yeah, you are not limited by the things that we ask.
And one point that I'll clarify about the reports, there are different reporting cycles, and Maggie kind of alluded to those earlier. So there are two different deadlines that you need to consider. The first is the July 15th deadline, and that's related to Operation Diabetes, Operation Heart, and Operation Immunization. So within each of those, the official timeline of events that you're reporting on is from June 1st to May 31st of that previous year. And so after May 31st of the year, so let's take 2014 for example. So on July 15th, The reports were due for June 1st of 2013 through May 31st of 2014. And we explain that in those reporting guidelines too. So if it's hard for you to understand if I'm saying it, and I know it gets a little confusing, definitely take a look at the guidelines. But you're reporting on the previous year. You submit in your reports on July 15th for those patient care projects. Generation RX is on a different reporting cycle. Those reports are due each January, and the reason they're due in January and not in July is because of the Utah school and some of the other things that the recipients of the awards receive related to that project. So that's the reason for the two different cycles. We just had a couple of questions there on that. Our next question, Maggie, I'm going to let you answer. There are a couple of questions related to Operation Immunization, and people are looking for some creative ideas related to that project. One of the comments that we have here states, we've really focused a lot on flu vaccines, but haven't expanded beyond that. What are some tips or ideas that you have for adding creativity into Operation Immunization beyond the flu vaccine?
That is an excellent question, and one place that you can look is to partner with your IPSF committee and work on different immunizations for overseas travel. Again, this is a really good collaboration within your chapter, but it's still a cool way to kind of work together and something that's different than the flu vaccine. Additionally, I know some chapters will focus on college students or, people that are just starting their freshman year and making sure that they have all of the vaccines that they need. I know at OSU we've had a couple of outbreaks of things that we should not have, so our chapter kind of worked with some of the dorms on campus to work with the college students. And then just general education about the adult immunization schedules. Maybe you're at a local pharmacy and you set up a table, and a lot of your pharmacies can provide these immunizations, and you can help, have you gotten this vaccine before, or do you qualify for it? Your pharmacist can give it to you right here. So there are a lot of other things you can do besides just flu vaccines. And also, you can help educate adults on the children's schedules. Even if you cannot participate in giving children vaccines, you can make sure that they're aware of what these schedules are and help educate them. So you can do a lot of education with Operation Immunization.
All right, our next question is related to Operation Self-Care, and the individual wants to know what is the update on self-care. Some of you may be aware of the project potentially being phased out, and so that's what this question relates to. And you may have noticed that Maggie didn't really talk about Operation Self-Care in the presentation, so I'll just give you a quick update on that and where we are right now. So with each of these national projects, in order to support you as students doing them and some of the resources that are related to them, as well as the awards that are associated with them, we do have supporters for each of our national initiatives. And you saw those companies listed on the slides. We're very grateful to have their support. We currently don't have one of those supporters for Operation Self-Care. And so if we, moving forward, we have asked that the chapters submitted a report back in July, and you may have been a part of that process, or your predecessor may have submitted that report on behalf of your chapter. So we will go through one more award cycle for those, or for that particular project. And then moving forward, if it's something that your chapter wants to adopt as a local initiative, we still have some resources that are available that you can certainly use, but it won't be a nationally recognized program. But if it is something that your chapter is passionate about and that you have chapter members passionate about, we definitely encourage you to incorporate that into some of your local initiatives. And Maggie, any thoughts or ideas on how people can add some innovation to self-care if they want to do it as a chapter project?
Yeah, so just to go along with what Crystal said, even though it may not be a nationally recognized initiative, you can definitely still continue on with this project at your chapter level. Again, we like to see that you're participating in other things that appeal to your members. Another update we're working on coming up with ways for you to take self-care initiatives and kind of plugging them into your other patient care projects. So, for example, maybe some healthy heart recipes for Operation Heart, and some exercise routines that you could come up with brochures and hand those out. Those are kind of self-care things. Additionally, if you just want to do general self-care, if it comes down to sunscreen and sun safety, those kind of things, you can still do those at your chapter as well.
And Maggie, our next question is for the chapter cookbook. So this particular individual has some ideas that they'd like to contribute and want to see other individuals' ideas. So how will they go about contributing these suggestions to the cookbook?
That is a great question. We do have the first draft kind of together, but I would like to expand. Right now, we do have a Google document where you can submit cookbook ideas. There's a little format. It really doesn't take that long. It's not meant to be a very long, it's a recipe. It's supposed to be short. So I think we can post that link onto the website, or maybe from our Facebook page, so that anybody who's interested in sharing their ideas can post their ideas there. Then what we do with those, we take them and we compile them into 4 separate documents. And these documents are meant to mimic the Chapter Achievement Awards reporting process. So there's the 4 different essays. So there's a leadership and operations section, there's a patient care project section, there's a policy and advocacy section, and there's a professionalism section. So there are going to be 4 different documents that kind of revolve around those different things. But once we do have those documents reviewed and edited, we will be posting them on the website. Stay tuned for more information. We don't necessarily have a date at this time, but hopefully very soon.
And once we post the chapter cookbook information, that's going to go in the chapter resources section. So you'll look in the chapter resources section of pharmacist.com for that information. For each of the patient care projects, they still have their individual pages, and that's where you'll find the information regarding the planning guides. We are finishing our updates to those planning guides and hope to have all of that information posted by the end of this week or early next week. So you'll see that information starting to turn over as well. Related to the reporting process, one of the numbers that you're going to keep track of throughout the year is how many individuals you've reached through both your public relations and media campaigns, as well as how many people you've reached for education. And I know there's always some confusion about what those 2 numbers mean. So I'll first go through those, and then we had a couple of questions about where do social media numbers get reported. So for APHA, we consider public relations to be the media type of outlet. So that's when you are being interviewed on the radio, or you've posted information in a letter to the editor, or you've done things on your Facebook or Twitter account. Those types of things that reach mass audiences through different media platforms, or even billboards for major highways, if you're able to post information there, that is considered our public relations numbers, and that's where you would put them. We consider education more of the one-on-one that you would do, or if you're doing a presentation to a group of individuals and they have an opportunity to ask questions and you have that face interaction, we consider that education. Screening, if you're able to talk to people one-on-one while they're being screened, that's also considered education. So that's how we distinguish those 2 numbers. If you're doing a campaign through Twitter or getting creative on Facebook through your projects and reaching out to people through those different media, that's great, and that shows a lot of innovation and use of technology. So you'll put those numbers when it comes to your reports within your public relations numbers when it comes time for those reports to be due. So our next question, Maggie, I'm going to let you take this one. Do you have any general tips for how you can increase student involvement in events? And I would just add on to that another question, which asks, are the patient care events for APHA-ASP members only? So could you address both of those questions?
Sure. So when it comes to increasing the number of people that get involved, one thing that I myself tried as a chapter president that I felt was successful was to seek out those people who might not want to be on the executive committee board, but they did want to be involved in something, and they were good leaders, and they, just might take a little pushing for them to come out of their shell. But I reached out and we found good chairs for our projects, and then we gave them goals, and we had them come up with their own goals about how many events they wanted to set up. So once we figured out what their goals were for the year, and we kind of pushed them and said, we want you to do at least 2 or 3 events per semester. Well, then it took some time for them to recruit some people to help them with these events. And then they got more people on board, and these other people were helping set up events, and then they surpassed their goals. So I really think it helps to reach out to people, find those, this little L leaders who might not be on the forefront of everything, but who would really thrive in taking on these leadership roles and helping to come up with events. If you can't really get a lot of people to take those leadership roles, maybe they're interested in joining the committee. If you have a bigger committee, you have more hands on deck. More hands on deck means more help to get things accomplished, and then you can have more events. But I think getting more people involved, you have to make sure you have events set up in place. Another important part of that is to make sure that these events are worthwhile. Now, I don't know about you guys, but there's been times that I've gone to volunteer somewhere, and I end up in a basement counting, popping pills out of unit dose packs. Now, though that's very helpful for the organization that I help out with, it's not a very meaningful experience for me. So a lot of your students are going to want to have some patient interaction and see how they can touch their community. So when you're setting up events, you want to make sure that they're meaningful and that they really benefit both your community and the students. And to do that, I think it also comes down to your relationships again. So talk to your advisor if you don't know where to start. Talk to some of your professors. Talk to the pharmacists you work with. These people, you'd be surprised at how excited people get about helping out with this. I had the opportunity to speak to some alumni once and kind of tell them about our organization, and they were, those people that weren't involved in APHA-ASP were just like, wow, that's so cool. And people emailed me and came up to me after that meeting, and they were like, hey, we'd love for you to set up a diabetes event at this pharmacy, or, you want to set up some flu clinics with us here? So I think relationships are also a really important part of that. So I know that was a lot of answers to that question, but I think that there's a lot of ways that you can help get other people involved, and that has to do with number and quality of events. And then the second question, could you remind me, Crystal? I apologize.
Sure. So the second question was, do students have to be members of the APHA in order to participate in the chapter's patient care projects?
So that's a very good question, and I believe that it is chapter specific. So for us, we wanted to make sure that we had people to volunteer at our events, and we wanted to make sure that, maybe people wanted to come to an event, but they weren't sure if they wanted to join APHA-ASP yet or not. So most of our events were not members only. It kind of depends, though. So all of our chairs had to be members. That's kind of how we did it. You could go to the events and not be a member, but in order to be a chair, you had to be a member. If you have limited events and maybe you use your events for reimbursement for your members, then maybe they should be members only. So it kind of depends on
what your chapter needs are. If you limit it to members only, are you going to have enough people to fill the spots? Are you going to overwhelm your members? Or if you open it up to the entire college, are you not going to have spots for your members to participate? Some chapters also do, members only first, and then if they still have some spots, then they'll take non-members. So it really comes down to what your chapter needs are.
And you can certainly use it as a recruitment opportunity too. There are a lot of benefits that come from participating in these projects, so keep that in mind as you're going through your membership campaigns too, and use it as a recruiting tool. And like Maggie said, think about it as an opportunity to help keep people involved. So we just have a couple of questions left. And these are really related to projects on the local level. So, and kind of tie into adopting self-care as well as a chapter level project. So if you are doing things on the local level, how do you report on those is the first part of this question. So Maggie, if it's not one of the national initiatives, where do those local projects get reported?
So these local projects would get reported in your Chapter Achievement Awards report. So again, that has the 4 sections, those essays, and there is a patient care project section in there. So what I try to tell chapters to do are go through, if you have other projects that are not the national initiatives, go through the national initiatives, just kind of give an overview. Give us, tell us the important highlights, because again, you're going to write a whole other essay for that another committee is going to read, but it's still reported somewhere. So give us the highlights, give us the, the most important things, and then use that rest of your word count, use that towards the innovative things that you're doing at your chapter. Another place that you can report these is the innovative report for the chapter achievement reports. So the innovative report is anything innovative that you are doing at your chapter. Now, this used to be anything to do with any projects, but we've recently changed it over to not include any of the national patient care projects. So we do want something that is different, that is not Operation Diabetes, it's not Operation Heart in your innovative report. So this would also be a really awesome place if you have a really cool project that you started that's super successful and you guys are doing all kinds of awesome stuff, put that in your innovative report as well. So patient care section of your chapter achievement reports in innovative.
And we do certainly encourage you to look for those opportunities on the local level. It goes back to what Maggie said at the very beginning, and that ultimately the goal of these projects is for you to help serve your communities and to help student pharmacists really become engaged in the profession early and start working on those skills. So look for that, mutual need. What does your community need? What can you as student pharmacists offer to them? And then use that overall chapter achievement report section. And all of the guidelines available for that are on the website. And certainly if you've got specific questions, we're happy to answer those for you. And that could potentially, moving forward, include self-care activities. So if that's something that your chapter members are excited about and is needed at the local level, you can definitely include it within that section. Our final question of the evening is about performing projects abroad, so patient care projects outside of the U.S. And the quick answer to whether or not you can perform these kind of health screenings really comes down to what your school says and what your state laws say about practicing outside of the country. So you first want to work very closely with your faculty and chapter advisor on what it is that you're looking to do, and certainly also being very aware of your state practice acts and what information they have for you, because you have to follow those guidelines first. But if those are approved and it's approved by your faculty and something that the chapter wants to do, you can certainly take your skills outside of the United States. And we have had some chapters that have done this, but it's very, very specific to what it is that you're looking to do. So work very closely with your chapter advisor and your faculty members for those types of projects. And so that was our final question, so I will turn it over to Maggie to close.
Awesome. Thank you, Crystal. Thank you again, everyone, for attending tonight. I really hope that this was helpful for you as chapter leaders or patient care vice presidents. I also want to thank Haley and Mallory again for helping us out. I'd also like to point out here, this is our education standing committee contact information. Again, we are the people that review all of the different patient care project binders that are on the website. So the different, all of the stuff that Haley was talking about, you know, everybody's looked through this. These are good people to contact. Your National Executive Committee members, your regional officers, please utilize all the resources that you have. If you guys have any questions, feel free to email any of us. We love to answer them. And I am looking forward to hearing all about your very successful years. So everyone have a great night, and we will see you soon. Thanks.